Our next guest is Dr. Jonathan Woods of Southeastern Nephrology Associates. Welcome to the show today, Dr. Woods. It's such a pleasure to have you. I'm so happy that you're here, and I can't wait to get started.
All right, thank you. I'm glad to be here.
Good. Now, how long have you been with Southeastern Nephrology Associates?
I joined in 2005, so this will be going on my 9th year.
Mm-hmm. Yeah. And where did you get your training? Where did you go to school?
I did undergrad and medical school at University of North Carolina, Chapel Hill, and then I did my internal medicine nephrology training at Wake Forest.
Oh, great. Great background.
Yeah.
So you've been here since 2005?
Correct.
And where were you prior to coming to the Wilmington area?
I came straight out of
school?
Straight out of residency. Yes, I did.
Oh.
So
wow.
I grew up in Raleigh, so I always wanted to get, we were down here visiting all the time, so I always wanted to get to this area. So I was glad to make it.
So you're familiar with the area.
Yes.
Oh, that's great, great. Well, we're really glad to have you, as I said, and I wanted to first start off with telling our viewers what a nephrologist is. That's kind of a long word, and I'm not so sure I know what that is, so let's start there.
And you're not alone with that. Nephrologists, we specialize in treating diseases of the kidney, and we really deal with how the kidney functions. The role of cleaning the blood, handling all the electrolytes, the potassium and the sodium and things like that in the blood. We also deal a lot with high blood pressure because that's largely regulated by the kidney, and the kidney plays a very big part in that. So we mainly focus on the function of the kidney. Now that's different. A lot of people get us confused with urologists, who are surgeons who deal with the kidneys, and they would be the ones that removed a kidney or took kidney stones out or did surgical procedures. But we're more along the actual function of the kidney aspect.
Kind of like an internist who looks only at the kidney.
Correct, correct.
So there is some relationship between the two.
Yes.
I mean, oh, good. Now that's a great explanation. I think I have it.
All right.
So let's talk a little bit about who might have risk for kidney disease.
The biggest risk factors in the United States for chronic kidney disease, and by chronic kidney disease we mean people whose kidneys don't function normally, and it's been that way for a while, but they're not yet on dialysis. They're not yet bad enough that they need dialysis to stay healthy. The two most common reasons for that in the United States are diabetes and high blood pressure. And this area of the country particularly, that is a significant problem. So we have a lot of patients here at risk. And given the epidemic of obesity as well, which contributes to the high blood pressure and diabetes, it's something that puts a lot of people at risk in this area. So, but those are the two biggest factors that contribute to chronic kidney disease.
Well, what kind of approach do you take when a patient suffers from kidney disease? Where do you start?
The first thing that we do is try to figure out why it is. And we presume because diabetic kidney disease and high blood pressure related kidney disease are so common, a lot of times that's presumed to be the reason. There are a list of other primary kidney diseases, and quite a long list, that attack only the kidneys that aren't related to other disease processes. So the first step is understanding why the kidneys don't function normally. After that, we tend to worry about, is this patient going to progress to a point where their kidney disease can't keep them healthy? They require dialysis. And there's a lot of different factors that contribute to that, and there's a lot of, and the biggest things revolve around controlling the other factors such as diabetes and high blood pressure. So once we have the cause, we try to keep people's kidneys healthy as long as possible. And after that, if we find people are progressing anyway, which some people, based on their kidney diseases, despite the ultimate therapy and treating them as well as we can, their kidneys will still continue to decline, preparing for what we're going to do at that point, whether it be dialysis, transplantation, and making preparations for that. So ideally, we try to delay it as long as possible through strict control of other comorbidities and other factors.
I see.
But then also be aware and prepared for if it does come to a point where those interventions haven't helped.
So typically you would probably receive a patient from an internist or a family practice physician who identifies their patient at risk for
Correct.
kidney disease.
Correct.
And they would come to one of a nephrologist in your group.
Yes.
And you would begin the preparation. You would try to maintain them, but then begin
Correct.
the preparation for that next step.
Correct.
Is that correct? So it would be very important for a patient to see a nephrologist before the dialysis, before.
That's right. That's right. And just to back up, the kidney function is really determined by blood tests. You can determine how well your kidneys are functioned by simple blood tests that are done routinely or recommended to be done routinely in patients who suffer from diabetes and high blood pressure. So once that's noted to be abnormal, then people are usually referred to us. But to your question, a lot of people will say, well, if the biggest thing is controlling diabetes and high blood pressure, that's what my primary care physician's doing.
Right.
How can you benefit? And the kidney, as I mentioned, does a lot of other things. It regulates your bone health. It contributes to anemia. Blood pressure control is different when the kidneys don't work well. So there's a lot of things that we specialize in taking care of other than just controlling the blood pressure and diabetes. And like you said, there are options available. There are different dialysis modalities, transplantation, that if we see people at the last minute, we've lost a lot of possibilities for options. We can only do emergency things at the last minute, and then that keeps people from a lot of different options.
So your goal with patients with chronic kidney disease, what might that be for folks who are not on dialysis? What might your goal be?
The biggest thing is trying to delay dialysis as much as possible. But also being forthright with the patients who show evidence that they are progressing, that they may be getting worse. And there is very good evidence that patients who get transplanted prior to ever getting on dialysis do much better with their kidney transplant. You can have a kidney transplant when your kidney functions less than 20% of normal, even though you can't go on dialysis until you're less than 10% of normal. So the studies show that the kidney outcomes in transplantation are much better if you've never been on dialysis. So again, recognizing early who's likely to progress and who may benefit from preemptive transplantation or other interventions to avoid dialysis.
I do want to talk about transplantation, but before I move on to that, I wanted to talk a little bit about dialysis options.
Okay.
I know that there is such a thing as home dialysis.
Correct.
And then I know of patients who are in dialysis at a unit and so forth. So if we could just talk about the home dialysis a little bit and the different types of dialysis.
Dialysis in general involves using a machine to clean the blood in place of the kidney.
Right.
So the conventional dialysis involves people going to dialysis unit 3 days a week, usually for 3 to 4 hours at a time, and basically connecting to a machine, and the blood circulates through the machine. And the toxins are removed that the kidneys aren't doing.
Right.
There are other types of dialysis, one called peritoneal dialysis, which involves putting fluid in the abdomen, and it does the cleaning of the blood through a procedure where the fluid sits in the abdomen and pulls the toxins out of the blood, and that can be done at home. It can also be done at home at night where people hook up to a machine.
Really?
Their dialysis,
that would be great.
Dialysis is done while they sleep. They get up during the day, and then they have their days free and are not required to be at the dialysis unit. We also have the type of dialysis that you do, the hemodialysis that you do at the dialysis unit is available to be done at home as well. It's typically done 5 days a week, but it's done a little bit shorter, 2.5 to 3 hours, but it's done at home in your easy chair. You can turn on a movie and do your dialysis at any time that you choose. So here in our Charlotte unit, we do have peritoneal dialysis center. We do the home hemodialysis out of the Wilmington unit, but that is an option that's here in Brunswick County.
Well, are there particular patients that you identify that are better candidates for home dialysis? Is that a?
I think anybody
could be.
I think
potential candidate.
The biggest things that limit people are, for our diabetics, eyesight can be an issue. I think dexterity is important.
Sure.
And having a home environment. If people live alone, it's a little more worrisome.
Yeah.
But outside of that, I think pretty much anybody, it's extremely simple. It gives people their freedom. And like I always say, dialysis should fit around your life and not
the other way around. Yeah.
And it
That's
gives
a good
people
point.
that option. So
Right.
there's not many people that we'll say no to. And we'll give them a shot and
Great.
see what we can do.
That's awesome.
Mm-hmm.
Well, to shift the focus a little bit, you have touched on transplantation,
Mm-hmm.
and I know from personally talking with you, you're very passionate about organ procurement.
Yes.
So let's move into that and talk about transplantation a little bit and where we get those organs from.
Right. Transplantation, for most people, particularly our younger population, should be considered the goal, the ultimate treatment for kidney disease.
Wow.
Dialysis, in the mind of a nephrologist, is something that bridges people to transplantation. And that's what I try to encourage people. If people get discouraged about going on dialysis, that this is just something to tide you over till you get your transplant.
Really?
As far as the people waiting, there's 80,000 people waiting for kidneys in the United States right now. And the biggest problem we have is that 3,000 names are added to that list every month, and that's something that we've got to change. Hopefully technology's down the road, but right now our real focus is we've got to have people donate their organs. We can't have people taking good organs in the ground. We've got to have people donating their organs. And compared to dialysis, there's very good data that both quality of life and life expectancy is extended with transplantation. Yeah. And so I know it's the motto or maybe even cliche of giving the gift of life, but it truly is something that can be done that will extend life expectancy for people. And just agreeing, when people sign up for driver's license, and just agreeing that, yeah, I'll be an organ donor is such a simple thing to do, and it will extend somebody's life. And I am very passionate about it.
I can tell that you are.
It's a frustrating thing to see when people are hesitant to do that.
Yeah, I know. I myself am an organ donor and have been ever since I got my driver's license, which was many years ago. But I think that people are often just have a fear of it. I think maybe we need to publicly talk about it more and get the word out there, because it doesn't hurt you. It's not going to hurt to give that organ.
Correct.
And then we need to talk with our families about it to make sure that actually does happen.
That's
because whatever I can do to help somebody else after me, I'm all for.
Right.
So I think that I'm glad to hear you talk about it so passionately, and hopefully our viewers will sign up to be an organ donor after talking about all this. Is there a way to get more information about organ donations and
Donate Life North Carolina is a very active group here in the state, and there are Donate Life groups all over the United States.
Are there?
But there is a Donate Life North Carolina. I know that they're on Twitter, they're on
Really?
Facebook, they're very active. And that's a great place to get information. It also gives information about living donation. I've been surprised at the number of people who have stepped forward for my patients and decided that they would give a kidney. There's good data following people long term.
That's a great gift.
It really is, and there's very good data long term that is suggesting that people who donate a kidney are at very, very minimal risk for worsening kidney failure down the road. And now we're working even with paired donations. So if you want to donate for someone but you don't match, they'll find someone else in the United States that it does match, and then they've had pairs up to 18 people matching the organs, trying to find a combination of people that can donate.
That is such an awesome
We're getting very
story.
aggressive with even living donors. So.
Wow, that's great. Well, I can't thank you enough for all this valuable information. I have learned a lot, and I know our viewers will be so appreciative of what you had to say. And I think the organ procurement conversation, it's a great place to begin, and I hope that many people will have that out in their communities. And I know that I'm going to visit that website and see how many opportunities I can find to actually talk about that. So thank you for that.
Yes, ma'am.
And how might we contact you? Do you have, can we call you at your office to schedule appointments, and how can we do that?
The best way to do is, like I said, it's a very easy blood test to determine how well your kidneys are functioning.
All right.
And I'd recommend that everyone with diabetes, high blood pressure, or even at your yearly screening physicals, request that be checked, that your kidney function be monitored, and if there's any abnormalities, that we're easy to find. We have plenty of locations that people can find us.
And I know you're in Brunswick County, right?
We have an office in Supply, that is correct. We have an office in Wilmington, Jacksonville, and Whiteville as well. So.
Great, and you're accepting new patients?
Yes, ma'am.
Great. Well, thank you again so much.
It's my pleasure.
So appreciate you being here, and I hope to see you soon.
Thank you very much.